Myself, Dr. Jitendra Patel, Professor and Head, Anatomy Department, NHL Municipal Medical College. We will discuss today about the femoral triangle. We will discuss about the femoral triangle, boundaries, content, and everything. First of all, we will start from the skin. This is the demarcating point. This is the anterior superior iliac spine to the pubic tubercle. I have cut the skin from the pubic tubercle to the adductor tubercle. I have another incision which I have put it, and I reflect the skin of the front of the thigh. Today we will discuss about the boundaries of the femoral triangle and the content of femoral triangle and clinical aspect of the femoral triangle. So first of all, we will discuss about the boundaries of the femoral triangle. The base of the femoral triangle, which is formed by the anterior superior iliac spine to the pubic tubercles, you have to draw the transverse line. It is the inguinal ligament. It is the most lowest fiber of the external oblique muscles. So this is the external oblique muscles, and it is most lowest fiber of the external oblique, which makes the base of the femoral triangle. The medial boundary of the femoral triangle, which is formed by the medial border of the adductor longus. So this is the adductor longus muscles, and the medial border of the adductor longus, which is considered as a medial boundary of the femoral triangle. The lateral boundary of the femoral triangle, here you can see this is the lateral boundary of the femoral triangle. It is the medial border of the sartorius muscles. Here you can see this is the medial border of the sartorius, which makes the lateral boundary of the femoral triangle, and this is the femoral triangle, and the apex, it is a meeting point of the medial and lateral boundary, and it becomes continuous as below to the sartorius there is a subsartorial canal. Now we will discuss about the roof of the femoral triangle. The roof of the femoral triangle, which is formed by the skin, superficial fascia. This is the yellow color, it is the fat, it is called the superficial fascia, and deep to it you can see there is a portion of the deep fascia or fascia lata we have removed. This is the fascia lata. Inside it is a sleeve like, completely covers the thigh, and it makes the roof of the femoral triangle. So the roof of the femoral triangle, which is formed by the skin, superficial fascia, fascia lata, as well as there are many cutaneous nerve which is also makes the roof of the femoral triangle, and it innervates the cutaneous distributions to the femoral triangles. So first of all, I will show you the cutaneous nerve. Here you can see this is the first cutaneous nerve, which is just inside. This is a lateral cutaneous nerve of the thigh, and this lateral cutaneous nerve of the thigh, it have two divisions, and which is completely separate from the femoral nerve. So this is a lateral cutaneous nerve of the thigh, which innervate to the anterolateral sides of the cutaneous distributions on the thigh, as well as the anterior side of the gluteal region, which is innervated by the lateral cutaneous nerve of the thigh. Another cutaneous nerve of the thigh, it is the intermediate cutaneous nerve of the thigh. This is the intermediate cutaneous nerve of the thigh, which is the cutaneous distributions to the front of the thigh, skin over the front of the thigh, which is innervated by the intermediate cutaneous nerve of the thigh. And third one is the medial cutaneous nerve of the thigh. Here you can see this is a medial cutaneous nerve of the thigh. Here this nerve slightly broken here because so this is a medial cutaneous nerve of the thigh, and this medial cutaneous nerve of the thigh which innervate to the medial side of the front of the thigh, as well as here you can see this nerve, it is a genitofemoral nerve which is over the femoral artery, and this femoral branch of genitofemoral nerve which supplies to the skin over the femoral triangle. I have not dissected here. There is a ilioinguinal nerve which is innervate to the root of the genital organs, mainly the mons of pubis, as well as there is a scrotum anterior 1/3 part which is innervated by the ilioinguinal nerve, but I have not dissected right now. So these three cutaneous nerve you will see here: medial cutaneous nerve of the thigh. This one is the medial cutaneous nerve of the thigh. It divided into the two branches, as well as there is a intermediate cutaneous nerve of the thigh, and this one is a lateral cutaneous nerve of the thigh. Here you can see this one is a lateral cutaneous nerve of the thigh. So these are the cutaneous nerve, as well as this is the great saphenous vein along with anteromedial tributaries, anterolateral tributaries. This is the superficial epigastric tributaries, and this is the superficial external pudendal vein. So these all are the tributaries of the great saphenous vein. This is a great saphenous vein which is open inside the femoral vein through the saphenous opening. It is a saphenous opening, it is a gap inside the fascia lata, or it is the gap inside the deep fascia. It is called the saphenous opening, and it is covered by the superficial fascia. It is called the cribriform fascia because it pierced by the so many veins and lymphatics. That's why it is called the cribriform fascia. So these all structures which are making the roof of the femoral triangle, these are the three cutaneous nerve: lateral cutaneous, intermediate cutaneous, and medial cutaneous, great saphenous vein, its tributaries, as well as there is a branches of the superficial branches of the femoral artery like this one. This is the superficial circumflex iliac, as well as on the medial aspect you can see here this artery, small artery. It is a superficial external pudendals, and the small another one, it is the superficial epigastric. Here you can see this superficial epigastric artery. So these are the three superficial branch of the femoral artery which is lies inside the roof of the femoral triangle, as well as these are the superficial lymph node. These are the horizontal lymph nodes, and vertical group of the lymph node I already removed, but the horizontal lymph node, some of the lymph node here you can see this lymph node which makes the also inside the roof of the femoral triangle. Now we will discuss about the floor of the femoral triangle. Floor of the femoral triangle which is formed by the adductor longus. Just lateral to this adductor longus, this muscles, it is called the pectineus. This is the pectineus muscles, and lateral to this pectineus muscles, here you can see this is the psoas major muscles, and this one is the iliacus muscles, and this one is the sartorius muscles, but it is not lies inside the floor, but this is the iliacus, psoas major muscles, and this is the pectineus and adductor longus. These are the four muscles which making the floor of the femoral triangle. Now we will discuss about the content of the femoral triangle. Mainly the femoral triangle which contains the lateral to medial, you have to remember navel. This is the nerve, femoral nerve. It is formed by the posterior division of the L2, L3, L4, and it makes the femoral nerve, and which is outside the femoral sheath, and this is the femoral artery, and this one is the femoral vein. So femoral artery and femoral vein, and there is a deep inguinal lymph node at the most medial compartment, all three which is covered by the one sheath. It is called the this sheath, it is called the femoral sheath. This is a portion of the femoral sheath here you can see, and this femoral sheath which is anteriorly formed by the fascia transversalis, and the posteriorly it is formed by the fascia iliaca. So on the back side it is formed by the fascia iliaca. So the femoral sheath, which is the only which covering to the femoral vessels into the upper 3 to 4 centimeters, and it is the obliquely, laterally it is vertical, and the medially it is obliquely, it covering to the femoral vessels. And this femoral sheath, which is divided into the three compartment by the two intermuscular septa. This lateral compartment contains the femoral artery, intermediate compartment it contains the femoral vein, and the most medial compartment, which here there is a cloacate and Rosenmolen lymph node which is lies, and this is the space where there is a chances of femoral hernia which is more through the femoral canal, most medial compartment of the femoral sheath. It is called the femoral canal, and from this canal which is wider inside the female and small vessels inside the female, that's why femoral hernia which is more common inside the female as compared to the male. So it is coming from the femoral hernia which is coming from the femoral canal. And just medial to this femoral canal on the deep side, here there is a lacunar ligament, but we will not dissected the lacunar ligament. Now we will discuss about the femoral nerve, and this femoral nerve, here you can see this femoral nerve There are two cutaneous nerve. This is the intermediate cutaneous nerve and this one is the medial cutaneous nerve. These are the branches of anterior division, as well as the anterior division gives the branches to the sartorius muscles. So in between these, here you can see these vessels which is coming from the femoral profunda femoris. It is the lateral circumflex femoral artery. This artery and veins together which divide the femoral nerve into the anterior division and posterior division. So here you can see this is the posterior division of the femoral nerve which is lies on the back sides, and this posterior division of the femoral nerve, it gives the mainly supplies to the four muscles, quadriceps femoris, and it supplies to the all quadriceps femoris, vastus medialis, vastus lateralis, intermedialis, and rectus femoris. Also, it gives the one largest branch which is goes along with the femoral vessels, and it is the saphenous nerve. And this saphenous nerve, through the subsartorial plexus, subsartorial canal, it enter and it supplies to the skin over the medial side of the leg. So up to the great toe, which is innervated by the great saphenous vein. So femoral nerve basically divided by the branches. It is the lateral circumflex femoral artery. Here now we will discuss about the branches of the femoral artery. Here you can see this is the first small branch. It is the superficial external pudentals, which is supplies to the pudental means genitals. It supplies to the genital organs, external genital organs. This is the artery which is the this is a muscular branches of the femoral artery, as well as here you can see this is the small artery which is the superficial circumflex iliac artery. This small superficial circumflex iliac, this is the superficial external pudental, this is the muscular branches, and here I have shown you this is the superficial epigastric artery. Now the deep artery or the largest branch of the femoral artery, this is the profunda femoris artery, and this profunda femoris artery, it also gives the medial circumflex femoral artery. This is a medial circumflex femoral artery. I have already shown you this. This is the lateral circumflex femoral artery and veins together, which is coming from the lateral aspect from the profunda femoris artery. So here you can see this is the superficial external pudental, superficial circumflex iliac, muscular branches, as well as here you can see this is a superficial epigastric arteries. This is a superficial epigastric artery, and this is a profunda femoris artery. And profunda femoris gives the medial and lateral circumflex, and then it becomes continuous downside. The femoral vein, it is the, here you can see this is a femoral vein, and the great saphenous vein which is open inside the femoral vein, and its tributaries you can see inside the femoral triangle. So these are the content, as well as the deep inguinal lymph node which is lies inside the most medial compartment. Here some of the lymph node I have already removed, but this lymph node which is lies into the femoral canal. So these are the content of the femoral triangle, and clinical aspect of the femoral triangle, which are the swelling which is occur inside the femoral triangle. Like this is the adductor longus, and some persons, those who are untrained person, when you ride the horse riding, at that time stretching of this adductor muscles on the both the sides. Sometimes there is a hemorrhage or micro hemorrhage which is inside the adductor longus, either adductor longus or magnus. It lead to hematoma, and this hematoma convert into calcified, and it forms the bones. It is a sesamoid bone. It is called the rider's bones. Sometimes there is a dilatation of the femoral artery or femoral vein, then it is called the aneurysms. Sometimes there is a this great saphenous vein which is always, when it open inside the femoral vein, there is always vein, and incompetency of this valve, it lead to there is a dilated part of the terminal part of the great saphenous vein. It is called the saphena varix. Sometimes there is enlargement of this lymph node inside the femoral triangle because of the any injury inside the leg, particularly when inside the great toe or middle toe or anywhere inside the leg there is an injury, it lead to secondary enlargement of the lymph node. It is the secondary enlargement lymphadenopathy it is considered. Sometimes there is a compression of the femoral nerve between the iliopsoas, particularly the athletic persons. There is a more muscles develop and compression of femoral nerve. It lead to there is a compression syndromes. Sometimes this lateral cutaneous nerve of the thigh, which is compressed, particularly it is passes below to the inguinal ligament, and this below to the inguinal ligament, it lead to there is a compressions of the lateral cutaneous nerve of the thigh. It is called the myalgia paresthetica. It occur particularly during the pregnancy, either inside the obese persons, as well as sometimes there is a normally the testis which is developed inside the abdomen, inside the iliac fossa. Gradually it goes downside into the deep inguinal ring, through the inguinal canal, then superficial inguinal ring, and then it enter inside the scrotum. When the testis retain into the any normal pathway, either inside the deep inguinal ring or it is inside the inguinal canal or superficial inguinal ring, then it is called the undescended testis. But this testis can deviate inside the femoral triangle, abdominal cavity, then sometimes which is also enter inside the femoral triangle, then it is called the considered as a ectopic testis. So these all are the clinical aspect of the swelling inside the femoral triangle. Most clinical aspect of the femoral triangle, it is the femoral hernia. When the femoral hernia, it is the protrusion of the abdominal content through the femoral canal, which is lies bounded medially by the lacunar ligament, laterally by the femoral vein, and posteriorly by the pecten of pubis and anteriorly by the inguinal ligaments. So the abdominal content which is protrude through this femoral canal, it is the most medial part of the femoral sheath, then it is called the femoral hernia. It is lies always below and lateral to the pubic tubercle. The femoral hernia, inguinal hernia, which is lies above to the pubic tubercle. You have to differentiate it point for the inguinal hernia. Inguinal hernia are the two types, direct and indirect, but we will not right now discuss. But always the inguinal hernia, which is lies above to the pubic tubercle, while the femoral hernia below to the pubic tubercle. So this is about to the femoral triangle. And another thing I will show you, it is this is the posterior division of femoral nerve, and this posterior division of femoral nerve, here you can see this is a femoral artery inside the subsartorial canal, and inside the subsartorial canal there is a basically two nerve main. This is the saphenous nerve, and this saphenous nerve, as well as there is another nerve, it is nerve to vastus medialis. This is the nerve to vastus medialis, and this is the saphenous nerve. Another two nerve, it is the nerve to rectus femoris and nerve to vastus intermedialis, which is goes inside the deep, and it supplies to the these two muscles. So we will not dissect it properly right now, but these are the two nerves which is supplied to the nerve to rectus femoris and nerve to vastus lateralis. This is the middle 1/3 part. We will discuss about the subsartorial canal. Middle 1/3 of the thigh, it is called the subsartorial canal, and inside the subsartorial canal, it is sub means below to the sartorius. So this is the sartorius, and below to this sartorius, middle 1/3 part, where the apex of the femoral triangle, which is end, and there is a lower upper 2/3 and lower 1/3, this junction where there is a femoral artery which is pierced to the adductor magnus. There, then it is called the hiatus magnus, and it is continues as a popliteal artery. This place it is considered as a subsartorial plexus. So upper 1/3 and lower 1/3, in between there is a middle 1/3 part, it is subsartorial canal, or it is called the adductor canal. So above it is bounded by the sartorius muscles, and laterally it is bounded by the this is the vastus medialis. So the laterally this is bounded by the vastus lateralis, and below it is medially and below it is bounded by the adductor longus, and below it adductor magnus. So this is the subsartorial canal into the middle 1/3, and the content are the femoral vessels, saphenous nerve, and what now to vastus medialis are the content of the subsartorial canal. Here you can see this is the saphenous nerve, and also this is the now to vastus medialis, and this is a femoral artery, and along with it there is a femoral vein are the content of the subsartorial canal. So above bounded by the sartorius, medially and below it is bounded by the adductor longus and magnus, and laterally it is bounded by the vastus medialis. So this is about to the subsartorial canal and femoral triangle. Hope you enjoy the lectures. Thank you very much.